It's World Stroke Day today, and an innovative new advancement in the treatment of strokes is becoming more widely available, including at University Hospital Wales in Cardiff. It's the fourth leading cause of death in the world, and now scientists have developed a mechanical clot retrieval procedure, which has been proven to halve the rate of mortality and reduce the risk of long-term paralysis in the patient. Interventional neuroradiologist Dr. Tufel Patankar is one of the pioneering surgeons who's been practicing this innovative new treatment. Good morning.
Good morning.
And you've been using this new treatment for a little while, haven't you? Before it became widely available. Can you tell us how it works?
The treatment is called a mechanical thrombectomy, and what we do is we use X-rays to pass a tube into a blood vessel which is blocked in the brain, and then we use that tube to carry the stent, and that stent kind of opens and picks up the clot, and then you can use the stent to pull the clot out from a blocked vessel.
I read that you compare your skills to that of a plumber.
I'm a very expensive plumber.
Well, indeed, a very well, absolutely. So, but it's that kind of theory, is it? Just for us to get our heads around it, that it's just almost removing that blockage.
Yeah, because we are merely talking about ischemic stroke. So, if a blood vessel in the brain is blocked, then distal to the blood vessel, the brain is not going to get oxygen and it's going to die. So it's very important to kind of open that blood vessel as soon as we can. And so what we can do is we just have to get across that clot and then use a device. Either you can suck it or you can put a stent in it and then use a device to pull the clot. And the idea is to get it as quickly so that the flow is back to the brain, and then the brain can get the oxygen, and that's one way of kind of establishing the flow.
And what kind of difference to outcomes for patients can this procedure make?
Well, we had a very good success in a lot of our cases, and now we have about 5 trials that have shown unanimously 50% improvement if you compare to the standard intravenous treatment. And the recanalization rates are pretty much about 80%, so 70-80%. So if you, in a big vessel, if you give just drugs, which is a standard treatment at the moment, and it's a very good treatment, when the large vessel, it works only in 20% of cases.
And so you mentioned that speed is absolutely crucial for this patient. Is that still one of the main issues surrounding strokes?
Absolutely.
In particular, patients recognising their symptoms?
Yeah, that is the most crucial point. We want patients to come very quickly. If you have a stroke, and a big stroke, and we are talking about big disabling strokes, they have to come as quickly as possible. Intravenous treatment is licensed to about 4.5 hours, whereas mechanical thrombectomy is a treatment where we can go in and pull the clot out. So we can do it up to 6 hours in the anterior circulation, which is in the front vessels, and the posterior circulation, we got a little bit more time. But the earlier you come, the better the results.
And if people were better at recognising the signs of a stroke, is it at all possible to estimate how many lives could be saved?
Yes, I think there is a very good paper which has come from Charing Cross, which has looked at cost effectiveness, and I think they looked at 71 deaths that can be saved over a period of 20 years. They have looked at some of the studies and they have compared that. But we can make a significant difference. I think you can make a lot of difference in amount of beds we can save, the cost effectiveness of the treatment over a period of time, because initial expense is quite a lot, because you have to kind of have the infrastructure in place to do this treatment.
Thank you. Thank you very much indeed for joining us on the programme this morning. That's Dr. Tufel Patankar.
Some amazing technology.
Incredible, isn't it?
Amazing technology there. In a few minutes' time, we'll discuss the rather more basic technology that we all